It's your channel. So, today we are going to discuss an important chapter in systemic pathology, that is GIT. So, from today onwards, let's focus on GIT. In GIT, we are going to discuss all about the esophagus. So, today in this video, we are going to discuss about the infective esophagitis, Barrett esophagus, and some of the important cancers of esophagus. Okay, so if you're not yet subscribed to the channel, please consider subscribing to the channel. Teddy guides you. So let's start the class. So esophagus, first of all, let's learn some of the important points of digestive system. And I'm so sorry for an blurred visual, blurred with image. I will make sure that I will keep best image in the next time. So this is digestive system. In digestive system, we are having, like, in mouth, we are having palate, uvula, tongue, teeth. And if you go further, we will have some of the salivary glands. And if you go more further, we will have larynx, esophagus. And this esophagus will leads to stomach, which leads to the small intestine. We all are aware that small intestine are having three parts: duodenum, jejunum, and ileum, and they leads to appendix and ascending colon, transverse colon, descending colon, sigmoid, rectum, and anus. So these are the important parts of digestive system. Okay, and now let's go to the histology of the digestive system. We all aware that it is made up of four layers. So I'm extremely sorry for this blurred image. Okay, so first one is mucosa, second one is submucosa, and third one is muscularis propria, and fourth one is serosa. In mucosa, we are having epithelium, lamina propria, and muscularis mucosa. And later we are having this submucosa, and below the submucosa, we are having muscularis propria. Okay, and below it we are having serosa or adventitia. Okay, and the most important point you should remember is submucosa is absent in gallbladder. Okay, so let's start about esophagus. Esophagus is nothing but the broad muscular tube. It is nothing, just a broad muscular tube. Okay, so now the question is, what is the length of the tube? Length of the tube is 25 centimeters. Okay, so it is a tube which is of 25 centimeters, and it is lined by stratified squamous epithelium. It is lined by, okay, select yellow. Okay, it is lined by stratified squamous epithelium. Okay, so it's just a muscular tube which is having four layers, which is of 25 centimeters length and lined by stratified squamous epithelium. Okay, so this is the basic information that one should know about the esophagus. Next one is infective esophagitis. Esophagitis means itis. There is inflammation. Inflammation to what? Inflammation to the esophagus, which is causing the inflammation. Okay, inflammation is caused by candida, cytomegalovirus, and herpes. So these are the organisms which are responsible for causing inflammation in the esophagus. Okay, so what, and the fourth question is, what type of people are getting this inflammation? The type of people getting this kind of inflammation are immunosuppressant people. Immunosuppressant means there may be people who are with the TB, tuberculosis, or HIV affected people, hypertension people, people with the cardiac failures, and people with some diabetes mellitus and some kind of diseases. They are having immunosuppressant. Means the immune system is very low. So these kind of people are more prone to having these infective endocarditis. So from every organism, we should know some important points. For example, candida. If candida is causing esophagitis, it leads to pseudohyphae and pseudomembrane. Okay, and let's see You are in the OP. A patient came and with cheap complaints of dysphagia, dyspepsia, and gastroesophageal reflux disease, GERD disease. Okay, and these are the chief complaints of the person. You thought that it was an esophagitis, which is caused by cytomegalovirus. Okay, so are you going to leave the patient like that? No, you are going to treat the patient because you know that these infective esophagitis can lead to shallow ulcers in the future. And in the histology, you can find Old's eye. Old's eye appearance is found in the cytomegalovirus esophagitis. So this is the hallmark feature that you should remember because dysphagia, dyspepsia, GERD are just the common diseases for any type of GIT infections. And the most important point that you should remember is Old's eye appearance. Okay, and next one is herpes. If the patient is affected with the esophagitis mainly by the herpes, you should remember the three M's, which is multinucleated, molding into one another, and migration. So three M's shows that the esophagitis is due to the herpes. So this is all about the esophagitis. Next one is Barrett esophagus. Okay, this is a very important topic that one should know. Okay, Barrett esophagitis. Same. You are in the OP. A patient came with chief complaints of heartburn, regurgitation, weight loss, dysphagia, and hematemesis. Okay, let's decode this all. Hematemesis, blood in vomiting. Dysphagia means difficulty in swallowing. He is not able to swallow the food. Why? He is getting regurgitation, means the contents of the food will come into the mouth. Hence, he is not able to swallow food, which leads to weight loss and which also leads to heartburn. So these are the symptoms in the Barrett esophagus. So you think you order an endoscopy and microscopy and stain. So by going to the endoscopy, after the results of the endoscopy, you get to find that there is a red velvety appearance. So by this, you will get to a conclusion that it is Barrett esophagus, and you will observe the microscopy. In that, you will see columnar epithelium. Normally, esophagus is not a columnar epithelium, it is stratified squamous epithelium. So, you come to a conclusion that a metaplasia has happened. What is this metaplasia? Metaplasia is nothing but a reversible change in which one differentiated cell type is stratified converted into another because means there is a change in the epithelium. What change? Squamous epithelium is changed into the glandular epithelium and stratified squamous epithelium. Hence you see columnar epithelium here. Okay, and you order a stain of Alcian blue. Alcian blue is a stain used for mucus glands. So here you will get to a conclusion the person is affected with Barrett esophagus. So what next? We came to a conclusion that it is Barrett esophagus. Next thing we should know is what segment, what type it is. Either it is small, short type or long type. Long type is more than 3 centimeters of the esophagus is affected. Short is either 3 or less than the 3 centimeters of the esophagus is affected. So what is the pathogenesis? We already know it is metaplasia, means squamous epithelium is converted into columnar epithelium plus stratified squamous epithelium. Okay, so what are the complications? Are you going to leave the patient like that? No, because it may lead to the adenocarcinoma. Okay, and the most important thing that you should remember is there is metaplasia of connective tissue, which is myositis ossification. Okay, and this also may be because of vitamin A. So vitamin A can lead to metaplasia. Okay, this is the important point that you should remember. This is a note point. Okay. Next, so this is all about the Barrett esophagus. Next one is esophageal cancers. Again, you are in the OP. It's too late. You're too tired because you are working for too long hours. A patient came with the chief complaints of dysphagia, weight loss, and anorexia. Anorexia means appetite loss. Okay. Okay. Later, after some examinations, you came to find out that is esophageal cancer. So, what type of cancers? Either it is benign or metastasis. Malignant. So in benign, we are having leiomyomas. And in malignant, we are having squamous cell carcinoma and adenocarcinoma. And you ask the patient whether he used to smoke or is he alcoholic, etc. And you will check any mutations in the SOX mutation or any Plummer-Vinson syndrome. Plummer-Vinson syndrome is nothing but a syndrome which are having the symptoms of esophageal webs, iron deficiency anemia, and chronic glossitis. So these are the three kind of things that you will find in the Plummer-Vinson syndrome. Okay. So these are the risk factors for a person getting carcinomas of the esophagus. Next one is some cancers may be cured easily, some are very difficult, and the cancers which get lot of time to cure are the cancers to the esophagus or gastric cancers or pancreatic cancer. So these are very tough cancers that needs lot of treatment to get cured. Okay. Next, the most important point that you should learn is H. pylori is protective towards the adenocarcinoma of esophagus. Okay. So let's learn some of the things about squamous cell carcinoma. In squamous cell carcinoma, we can find eosinophilic keratin pearls and desmosomes. In immunohistochemical markers, you find cytokeratin and P63. And prognosis factor is depth of the invasion. If the depth is more, prognosis less. And if the depth is less, prognosis more. Prognosis is nothing but the cure. Okay? And the most important points you should learn is rat tail appearance you find in achalasia cardia. Okay, and samoma bodies. Samoma bodies are nothing but the basophilic calcification. Samoma bodies you will find in spleen. In I think it's left ventricle failure. I'm not sure whether it is a left. It is right ventricle failure. Yes, in right ventricle failure, you see that there is defect in the liver and spleen. In liver, you find nutmeg cells, and in spleen, you will see samoma bodies. Okay, so this is all for today. I hope you enjoyed the class. If you're not subscribed to the channel, please consider subscribing to the channel. Teddy gets you. Please do like to the channel and comment me in the comment section about the class. And I'll meet you in the next Sunday. Thank you so much.